This is One-on-One. We are pleased to welcome Dr. Donna Stankiewicz, who is Associate Dean, Nurse Education and Sciences at Passaic County Community College. Good to see you, Doctor.
Thank you for having me.
You were just telling me that you've been involved in nursing for 39 years, which
Yes.
is fascinating because I'm curious when you knew you wanted to go into nursing.
I think as a child I had the interest in science and in health, but I didn't know at that time it would be nursing. You know, I thought about being a doctor, but as I got older and I realized that it is the nurse who spends all the time with the patients, so then I made my decision to be a nurse.
Nurse education
Yes.
is different from the hands-on nursing. Being a nurse education itself, I want to be clear on something. How has nurse education or nursing education changed in the last 10, 15 years?
Well, nursing education has to keep up with the practice of nursing because we are preparing nurses. We're preparing the next generation of nurses.
But what I meant was actually being a nurse versus being a nurse.
Being an educator?
Yes. Is it a different field?
It is a different field in this. It's two professions in one because you are still a nurse, all right?
Always
so I am
a nurse.
I'm always a nurse.
Right.
And I lead a nursing program that prepares new nurses. So you have to be an educator, and so you have that profession as well as the nursing profession.
Now, the profession itself.
Yes.
How much has the Affordable Care Act, we don't know yet because it's still playing out, how much do you believe it has affected and changed, evolved, if you will, the profession of nursing?
Well, I think we're continuing to see how that will play out, but in a number of ways. Economically, of course, it changes the profession of nursing by the way hospitals are reimbursed and what your workplace will look like and the economics of healthcare. And so, of course, economics of healthcare affect nursing practice as well. But it also has a role in increasing the areas that we will see nurse practice in or changing some of the areas that nurses will practice in. So a lot of healthcare is moving out of the hospital. And
what do you mean by that?
Patients don't stay in the hospital as long as they used to. Patients aren't admitted to the hospital unless they are, quite sicker than they used to be.
By design?
By design, but because we can care for them in other ways. And, a lot of the research shows that patients do better if they're not admitted to the hospital because sometimes you catch other things when you're in the hospital. So, and patients often do better in their home setting. So we get patients out of the hospital sooner. We move them to other facilities such as subacute facilities where they can still get treatment and some rehabilitation and then get moved home if that's where they're to go, and then to try to provide as much within the home so that the patients can be cared for in their own setting.
Doctor, talk to us about Passaic's nursing initiative. Describe it. What does it look like, and what kind of nurses are you producing?
Well, we have an associate degree program, and we produce excellent nurses. We have excellent outcomes. We are preparing nurses at the associate degree level to be bedside caregivers. Okay, so they are entering practice and primarily working in an acute care setting or a subacute care setting. We do have a proposal out to the state now to be able to offer an RN to BSN completion program, which
Explain that to people.
So when the students graduate, they sit for their licensure exam at the completion of our program to become RNs.
Registered nurses.
Registered nurses. So once they become a registered nurse, they can go into practice. Practice is more and more requiring that students have their bachelor's degree in nursing. Some hospitals don't hire without that now. So we want to be able to offer that degree to our students so that once they complete our program, they can then go on and complete the bachelor's degree, but be working as a registered nurse while they do that. So that, the preparation for nurses, whether they attend a four-year program initially or our program initially, they're going to sit for the same licensure exam. That's what makes them able to practice nursing. The courses that are not offered in an associate degree program would be things like nursing leadership, nursing research, community health or population health. And then, of course, the rest of the liberal arts that are required as a bachelor's.
Let me ask you this. You were saying before that when you got into nursing, it struck you that nurses are closer to patients, and even though doctors play an incredibly important role.
Right.
From your perspective, even though nursing continues to change, evolve, as the healthcare world around us evolves dramatically, what continue to be the most rewarding aspects of the nursing profession?
The interaction with the patient and their families.
That doesn't change.
That doesn't change, and probably that is some frustration that practicing nurses feel now is because of the increase in technology and things like that. It does sometimes pull them further away from the patient or because of patient loads, but you always want to focus on patient-centered care. The patient drives their care. It's about what that patient values, what kind of care, how they want their care to proceed. And so the patient and family have to be central. And for any nurse, that is the most rewarding aspect.
You still passionate about this field?
Absolutely.
Why?
Because it is a job that you can say every single day, I've made a difference in someone's life. Regardless of, you can be handing somebody a glass of water because they can't reach it for themselves, or, intervening when their condition changes.
Doctor, thank you on behalf of all of us who appreciate what nurses do every day. Thank you.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by
ShopRite Supermarkets,
New Jersey Council of County Colleges, the Give Something Back Foundation, Choose New Jersey, Century 21 Construction, Cone Resnick,
and by the New Jersey Office of the Insurance Fraud Prosecutor.
Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.